Watch this. Idaho's healthcare providers are running out of ways to say they're running out of options. Hospitals continue to scramble to treat as many people as possible. But space remains at a premium, while the latest COVID surge seems to know no bounds. The U.S. withdrawal and Taliban takeover created chaos in Afghanistan. U.S. citizens have risked their lives scrambling just to get home. We're going to hear from one woman who did just that. She made it onto a plane, but she did have to leave her sister behind. The record summer temperatures and drought conditions are creating more water quality issues, a situation that is now hitting Idaho Power in the pocketbook. Well, it's a new month, kind of 2 days into it. New week, same thing, 4 days into that. New day, but it's the same old message. Idaho medical leaders say this latest COVID surge is kicking their tail, and it's about to come to a head. They're running out of options as our hospital system sees significant challenges in the midst of what can certainly be considered the worst COVID spike to date in Idaho. Imagine having to make decisions about who gets medical care in the same way as a MASH triage doctor. In Idaho, not in a war zone. Well, that complicated equation to figure out who does get care and where they get that care is a daily struggle right now as Idaho and Northwest medical systems, they're simply running out of space and staff to care for some very sick people. And you add in the frustration with the fact a very large majority of those very sick people are not vaccinated against COVID-19. Well, today, once again, leaders of the Treasure Valley health systems did their very best to make this very clear. But haven't they done that already? Joe Parrish shares their cry for help, and this time, literally, as healthcare leaders wade into uncertain waters.
It is becoming more and more difficult, and we are really at the extreme of contingency conditions now.
Idaho healthcare leaders are sounding the alarm. The current COVID situation is getting closer and closer to a crisis. As it stands, care at major providers is significantly impacted by the growing amount of people infected with COVID now needing intensive care. Here's how West Valley Medical Center Chief Medical Officer Dr. Richard Augustus describes the situation.
It feels sometimes like we're rearranging chairs on the Titanic. There is so much that could be done to prevent this, but it's not.
Dr. Stephen Nemerson, Chief Clinical Officer at St. Alphonsus, says the impacts of this COVID surge could affect emergency care in the coming weeks.
The emergency room care they're going to receive is going to be delayed because it's a simple supply and demand phenomenon. We have more patients coming in now with COVID and other conditions, but we are prioritizing the most urgent, and then others that are less urgent will have longer waits. They will eventually be seen, but the waits will be longer.
The situation we've been in since early 2020 has certainly taken a significant toll on healthcare workers who work day in and day out in high-stress situations. Healthcare workers have spoken out with frustration in recent weeks, saying they are not machines that can go forever. They are human beings.
It's hard. It's hard when we go out in our communities and see large groups gathering, schools back in session with little accommodation for the infection prevention practices that are so important for shutting things down. It's hard to recognize just how serious the situation is within our hospitals.
St. Luke's Chief Medical Officer Dr. Frank Johnson quickly got emotional when reflecting on the heavy burden that medical staffers are dealing with.
And I can't help but get emotional when I talk about it. I apologize for that. Excuse me. How impressed we all should be with our healthcare workers who are stepping up in crazy, ridiculous circumstances to provide the care they need for their community. We're exhausted. Our teams are tired. They're worn out, and we need some help. We need some help from our communities to turn this around.
This week, Governor Brad Little said that the state was pulling out all the stops in a last-ditch effort to battle crisis in the Idaho medical system. That included calling in National Guardsmen, providing emergency funds, and calling on Idahoans to vaccinate. Critics say the state should go further. I asked healthcare leaders if they believed local or state government could go further in their actions to help the situation.
We certainly know that wearing masks, social distancing work to slow the spread of disease. We know that. If we had additional efforts to encourage those behaviors, that would be fantastic. It would slow the spread of our disease. We certainly recognize everyone's in a tough spot in terms of figuring out how to make that happen. So I'm not going to call anybody out for additional steps that could be taken to do that, but any efforts that could be made to encourage, at this point in the pandemic, more mask wearing and greater distancing, smaller gatherings would be helpful.
There's no doubt who Dr. Johnson is referring to with that last comment he made when it comes to gathering in large groups without wearing masks, with no mask requirement, that is. Talking to some schools, I'm sure, and other events like even the Western Idaho Fair, that kind of stuff. But turning it around is one thing. How about just putting a stop to making it worse?
I mean, we're in a situation now, Brian, where you want to, quote unquote, stop the bleeding, but the situation continues just to get worse. We see higher daily case counts. More importantly, we continue to see our ICUs filling up with people. Just today, Brian, on the medical call, they told us the West Valley Medical Center, they're getting calls from Oregon and Wyoming saying, can we send people your way? And that's something pre-pandemic you would never hear of the West Valley Medical Center, asking for people great distances away just to look for any medical coverage.
So it's not just an Idaho thing, and it hasn't been, but it's not just an Idaho thing anymore. It's now expanding to the region.
It's our region. It's the East Coast. It's the South. There's a lot of areas in our country that are in bad shape, Brian.
All right. Well, hopefully, once again, this message can be heard by a lot of other people. Thanks, Joe. Well, there's a common phrase, correlation does not imply causation. But when it comes to Payette County, maybe it does. Idaho's smallest county by land size is also a bit lacking when it comes to COVID vaccination rates. At 28%, Payette County is fourth from the bottom in Idaho based on the number of people vaccinated against the coronavirus. Now, knowing that, it should surprise few people. Payette County has now issued an emergency declaration because of, quote, the increase in COVID-19's presence in our communities and the impact on healthcare systems. This allows the county to use processes in their emergency operations plan. So now they can help local organizations and request resources and money from the state of Idaho and the federal government. Payette County commissioners, they're going to consider extending this declaration at their next meeting on Tuesday. And they're not just signing papers in Payette either. The high school is going remote until September 13th. This message from their homepage. It says they identified a cluster of COVID-19 cases at the school, and they also mention it not only affects the high school students, or this only affects the high school students, I should say, not any other schools in the district. They say they're sending additional information to parents as well to kind of fill in some of the gaps. But if only there was a way to limit the exposure to the coronavirus and the impact on our healthcare systems. Well, the pandemic has raised a lot of mental health concerns as well. People have been stressed out, isolated, and forced to constantly adapt as rules and guidelines change. The Boise Police Department is providing more services for people in a mental health crisis. BPD saying they're adding another civilian social worker and an officer to their behavioral health response team. The team has now doubled compared to 6 years ago. Now they have 2 mental health coordinators and 2 officers. The newest mental health coordinator is also an adjunct professor at BSU in the psychology department. The team's goal, they tell us, is to connect people with the needed social services they need, I should say, and reduce future interventions from law enforcement. So not defunding the police, but reallocating the resources, which is really what that rallying cry was all about. After a terrifying and trying journey, an Idaho woman is home from Afghanistan. Unfortunately, her sister wasn't able to get on a plane with her. All right, this is part of the show where we ask you to join the conversation. Just send us a text, 208-321-5614, and let us know what you think about the show and what we've talked about. Send those messages complete with your name and the hashtag #the208. That way, we know who gets the credit when we share yours at the end of the show.
It really underscores for you sitting here comfortably in Boise, Idaho, with the kind of challenges that go on around the world. We had Idahoans contact us on about 300 people who are non-U.S. citizens. They're in various stages of applying for visa or something like that. So those are more challenging, and the results were much more checkered than the ones who were U.S. citizens, residents of Idaho. Those we were 100% successful in getting them out.
Senator Jim Risch on how his office has been busy during the evacuation of Afghanistan, where a week ago more than 100 people were killed, including 13 U.S. service members at the Kabul airport during those evacuation efforts. More than 100 U.S. citizens still today are attempting to navigate their way home. Senator Risch successfully brought home around 10 U.S. citizens. Back to Idaho last week. Katya Stepovic spoke to one of those Idahoans who was able to make it home safely.
Wahida Ivy is a United States citizen who was born in Afghanistan and left in 1981 when Russia invaded the country.
That childhood nightmare will never go away because I lived it. But you know, this last trip that I took to Afghanistan, it tops it.
Wahida says her 6-day trip was to see her sister and cousins, potentially for the last time. The 6-day trip felt like a 6-year journey.
Any Afghan would have an idea what's about to happen. The word of we must leave Afghanistan as far as United States decision to get out of the country after 20 years, and rightfully so. I knew what was about to happen. I also knew that if I didn't go see my sister, I'd probably never get to see her again.
But Wahida and her family never pictured that this is what the end of the war would look like.
People that worked for the United States, for the companies, to get them out first, they should be priority. It was anything but that. It was total disorganization, to say the least.
Wahida says she made 5 attempts to get on a plane back to America.
I called he was in contact with me. But I told him, I said, I think tonight if I don't call you back, or if I didn't hear from you, or you didn't hear from me, I'm probably going to be dead somewhere. Pushing, shoving, Talibans are there at the gate. They're hitting people with the wires, and I have bruises. I took a couple of the hits. They don't see people. They just see them as like this rush of animals standing at the doors. And these people are just desperate to make it through that gate.
During one of her attempts, she decided this time her sister was coming with her.
They don't check really any of your documents. They just open the gate enough for at least 4, 5, 6 people out of thousands to get in. And we got in a line. We were there all day, from 5:30 in the morning all the way till 9 p.m. where she passed out and I passed out. Mind you, this is almost like a mile walk. No water, no food, and the temperature was horrendous. She passed out. Eventually at 9 o'clock, she said, I don't want to be here. I want to go home. And we were literally right in front of American soldier waiting for them to open the gate.
Wahida says her sister is older and not in good health. She simply couldn't handle the conditions any longer and went back home. On the 5th attempt, Wahida boarded the plane with her cousin, who is an active U.S. Embassy employee. She said her cousin was not let in, but 400 non-U.S. citizens were.
We saw women got on the floor. People were just walking on them. We saw babies, literally babies, and I'm sure you saw a couple of images where the soldiers was watching this happening. So instead of, they were just pulling babies by the arm from, falling on the ground with their mother holding them, being pushed to the gates. When the suicide bombing happened, you see this river of blood, and what kind of, you just can't. Not everybody have the stomach for it, even after 45 years of war. You can't stomach seeing people's shoes, seeing people's clothes, seeing their blood is just running down that river. and just say, pretend like it's not there. You just can't.
The other thing she can't forget, the situation that her sister and thousands of others are left in.
Under Taliban's in control of the country, women have no place. You can be a lady at any age, go out just to get yourself a grocery, something as simple as that, unless you have a man accompany you, or have an escort with you, a male escort with you, to go out and do the basic everyday life thing. Right now she's terrified. I talked to her yesterday. The street that she lives in, when she got up in the morning, was hit twice with the rockets. So she was in her basement, literally in her basement, terrified, because they don't know where the next rocket or bullet's gonna come from. So yeah, all around, for in particular women, it's not easy to be there or live there.
And you're not there to be able to protect her?
No, I'm not.
How does that make you feel?
Sad. Very sad. Especially know that this was going to happen. It did happen. And you know what's going to happen. This was a 40-year war and still continues to this day.
While she is forever grateful to be back home, she says there's more to be done.
We must hold on to that promise that we made to the people that worked for us, to the people that hold our hands when we needed our hands to be held. That they deserve much better than that. And that we should not turn our backs to them. It's not okay. I want people to understand that these are also human beings. They have families, they have children. It is their home, but it's not a home safe for them to live in.
Now, Senator Risch was able to bring back, Senator Risch was happy to be able to bring back Wahida and several others safely back to Idaho. But he says the process was a bit challenging. He worked with the State Department and gave specific instructions to Wahida's husband to relay to her. He's no stranger to this process, but he admits that this situation was unique simply because of the chaotic conditions on the ground. And like he said before, there's still about 100 U.S. citizens still needing to get out. Brian?
Yeah, but all of the Idahoans that wanted to get back that had the proper paperwork are back home. Is that correct?
Correct. Yes, the U.S. citizens from Idaho are all back.
All right. Thank you very much, Katya. Warm water is great for taking a bath or soaking in a hot tub, but for fish, not so much. In fact, it can be deadly for them. And now Idaho Power is going to have to pay a hefty chunk of change to try and cool the reservoir water back down. Hot topics or cool stories, we like to hear about them all. What you think we should talk about next or what we've talked about today. We want to hear your comments and questions. Yeah, complaints are cool too. Just keep them clever, if you can. Send them all to us, 208-321-5614. We're going to share some of them at the end of the show. Oh, and don't forget your name and the hashtag #the208. Idaho went into 2021 already abnormally dry. Well, 63% of the state was in that state on January 1st, according to the U.S. Drought Monitor. And sadly, spring didn't help. That abnormally dry trend continued, so that by summer, 92% of Idaho was in a drought. But less than 1% of the state was seeing extreme conditions, so that's good news, right? Still not a good way to start the dry season. Well, now here we are 3 months later, the drought only getting worse. 88% of the state still in a severe drought. 65% is extreme, which is up from 57% last week. In those Burgundy areas there, that's 21% of the state in an exceptional drought. Where things have changed have been kind of in the middle there. But what does that mean for us? Well, more of what we've already seen so far this summer, unfortunately. Farmers unable to plant crops or feed their cattle, which leads to cutting herds and, of course, an increase in fire danger. Even in severe drought conditions, which is supposed to be an improvement from extreme, we see low river levels, which leads to a drop in hydropower. And with less water running through the dams to create electricity, that means there's more water stuck behind those dams, just sitting there and warming in the record-breaking summer sun. And that is why Idaho Power, the company in charge of the dams on the Snake River, known as the Hells Canyon Complex, they're now having to pay to mitigate some of those impacts. Two conservation groups and the state of Oregon settled a lawsuit that spawned from the pollution and warmth of that water. It's an agreement that forces Oregon now to help improve water quality and the problems that come with warmer water temperatures. The Hells Canyon Complex includes the Hells Canyon, the Brownlee, and the Oxbow dams, all of which are owned and operated by Idaho Power. What normally happens with that Snake River water, the runoff from farms upstream kind of enters the river, and it's usually warm and nutrient rich. It would usually just run downstream and kind of dissipate as it goes, but with the low water year, it's been sitting in place for far too long. And in that reservoir, the nutrients break down and create a toxic pool of quicksilver or mercury that then gets ingested by fish and then becomes a health threat to anyone who eats those fish. The settlement requires Oregon and Idaho Power to each invest $750,000 to limit the amount of mercury. The work is also going to have to be completed by 2023. Now, it didn't specify what type of work or how to fix the problem. They're going to have to come up with that plan together. While warmer waters sound nice to people, it's not good for fish, especially those in the salmon family. High water temperatures, like the ones we saw this year, can be lethal. The settlement also creates a temperature limit and how it should be monitored. This is all to help those fish and the watershed. But if temperatures stay high and the water supply stays low, well, it could be a really tough problem to solve. Shelly texted in and said, well, we have doctors crying during interviews. It should be a wake-up call for everyone. But I want to share this email that we got today that kind of addresses those that still deny that the hospitals are filling up with COVID patients. Tony says the solution to their continued denial is quite simple. They all need to go to volunteeridaho.com and sign up to volunteer at the hospitals. We who work in the hospital need the help, and they can judge firsthand how busy we are taking care of all of our neighbors and families. I have urged the West Ada School District School Board as well as Dr. Bubb to do the same. I haven't received a reply. That's a good idea.